Now we'll talk about Pneumocystis jirovecii, which is responsible for causing pneumocystis pneumonia, or PCP. No, I'm not talking about the recreational drug that gives you superhuman strength and nystagmus, although that may be more fascinating to talk about. We do, however, give you a very interesting sketch involving the most exciting sport known to mankind. Only the best of the best, the creme de la creme of athletes can play it. I present to you the sport of ping pong. Pneumocystis pneumonia is a double P, just like ping pong, so that's going to be the focus of our scene. And this is a very specific ping pong tournament. I welcome you to the charity ping pong tournament titled Aid for AIDS. Can we make it more obvious that the fungus is associated with AIDS? Probably, but we'll talk about some other features first. Considering pneumocystis causes pneumonia, how do you think the infection is transmitted? That's right, through respiratory transmission. Now, I did mention that the fungus is associated with AIDS. However, it can infect healthy individuals as well. It is, however, asymptomatic in these healthy people, so immunocompromised people are the only ones who show signs of the infection. To demonstrate infection in both healthy and immunocompromised people, let's draw in our players. Notice how one of the players who's holding our immunocompromised cane is old and coughing? Well, this is to help you remember that symptoms are evident in immunocompromised individuals and not so much in healthy people, like the other player over here. Alright, moving on. Let's elaborate on the association with AIDS. PCP is one of the AIDS-defining illnesses. It's associated with a CD4 count of under 200. To represent that, we're going to draw this scoreboard here with a score of 20 to 0. Together, they look like the number 200. 20 to 0 would be the match point in a shutout ping pong game. So if you think about this old immunocompromised guy getting demolished in a 20 to 0 game, you'll remember the CD4 count of 200 being the critical value when people start becoming susceptible to PCP. This is also the value in which you'll want to start prophylaxis. And we'll get to what medication you'll need for that later. Okay, so we know that PCP is a pneumonia. More specifically, it's a diffuse interstitial pneumonia. It'll cause pneumonia-like symptoms with cough, dyspnea, and fever, but it won't be a productive cough like in our bacterial pneumonias. Also, you won't really see the consolidations that you see with bacterial pneumonias on chest x-ray. Unfortunately, sometimes you may not see anything on x-ray at all. However, if you do see something, it will have a ground glass appearance in both lungs, which looks like a wispy, diffuse infiltrate. We'll illustrate this with our glass ping pong tables, which are meant to symbolize lungs, and we'll draw some cracks in both of these lungs on both sides of the net to represent the ground glass appearance. In an exam, you can expect to see something like this pattern in a picture, or more likely a description of it with this ground glass appearance being a buzzword. So let's say you have an HIV patient with a CD4 count below 200 and some ground glass infiltrates in his lung on x-ray. How would we confirm the diagnosis of PCP? The best way is by getting a good, adequate sample with bronchoalveolar lavage, or BAL. This is essentially a bronchoscopy procedure that obtains lung samples through fluid rinses. To help you remember this, we'll draw a player in the back who's squirting water into his mouth with the bottle labeled BAL. A lung biopsy will also work, but it's definitely more involved and more invasive than a simple BAL. Upon getting the sample, you then have to do a methamine silver stain of the tissue to identify the fungus, which will look like disc-shaped yeasts. To remind you of this silver stain, we're going to draw some silver discs in the center of our table. Again, this also illustrates the shape of the yeast form. They're ovoid. Also notice how all the ping pong balls are oval-shaped. And notice we have some crushed ping pong balls on the floor. And this is because that ground glass appearance I was talking about on x-ray can also look like crushed ping pong balls. Now it's time to talk about prophylaxis and treatment. As we just talked about, you must begin prophylaxis in an HIV-positive patient whose CD4 count is below 200. So remember that number on the scoreboard, 20 to 0. Luckily, the prophylactic drugs are the same drugs we use to treat actual infection. The drug of choice is Bactrim, otherwise known, which is a combination of trimethoprim and sulfamethoxazole. To represent Bactrim, we're going to use the word backhand, which is what our geriatric patient here is doing on the left, to try to win that final point. Also, to stick with our recurring symbol for sulfa drugs, we'll have a jar of ping pong balls here in the back that look like the jar of eggs that we use to represent sulfa drugs. Another drug that you may be tested on, especially in patients with sulfa allergies, may be pentamidine, which can be used both prophylactically and for treatment. We can illustrate this drug just by changing the shapes of the paddles that our players are using. We'll make them into pentagons. This pentagon should help you remember pentamidine. And that about wraps up PCP. The buzzwords and vignettes that you need to know for this fungus are HIV-positive patients with pneumonia, CD4 count under 200, Bactrim is the sulfa drug for prophylaxis, and finally silver staining for diagnosis. And that's it for PCP.